right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, community pharmacist of the world. Your doctors are busy, your pharmacists are busy. They don't have time. For this hour, I do. So call in with those questions and those comments. I did want to touch back with the gentleman who called in about the prostate because I want to talk about how important that is. Many of us are losing sleep, talking about men now, well, some ladies too, because we have either prostate or bladder issues. And so sometimes we tend to think, oh, I'm just sleeping, I'm not getting enough rest, I'm not eating right. No, your quality of sleep is being disturbed, and so you're not able to have good sleep hygiene. And so things like your prostate are very important. Gentlemen, if you're getting up, 2, 3, 4, 5 times a night, take something like saw palmetto, and actually I have a proprietary product called Prostate Relief, which has saw palmetto and some other things in there that can decrease the blood pressure in the prostate gland so that once you do go to urinate, you don't have that delay in starting. It fires right up, and it empties completely, because what happens is when you have prostate issues, you don't empty all of the urine out of your bladder. You may go and shoot out 1 or 2, 3 second stream and think you're done. As soon as you lay down, you'll feel like you hadn't let anything out. And that's because we still have that prostate issue going on. We needed to totally relax and let all the urine that's supposed to evacuate out. Likewise, with the bladder, you're trying to lay down and get a good night's sleep, and that bladder is constantly contracting. And so we need something to relax that smooth muscle, and that's why we recommend pumpkin seed oil. Slows down those contractions. So fellas and ladies, you feel like you always have to go with that urinary urgency, pumpkin seed oil is going to be the thing that you need. Works wonders. And that comes in a capsule and a liquid. So these are two things that a lot of people come to me and say that they have insomnia. And it's not insomnia. You have poor sleep hygiene secondary to bladder or prostate issues, okay? All right, so it looks like we've got another call here. We've got Richard. Welcome to Pharmacist on Call. How may I help you?
Hello?
Yes, sir.
I've been going to the VA over 30 years.
Yes, sir.
The Veterans Hospital. And I've got a question for the doctor.
Yes, sir. What's your question?
I'd like to know if I'm taking Halidol, and I wanted to know what the side effects are, and I wanted to know if you're taking too much Halidol, would it cause your hand to shake when you ride?
Okay. Pretty good question. I'm going to put you on hold here.
Yeah.
Okay. All right. Well, I tell you, I'm going to leave you on because I may have some further questions. All right. So for everyone who didn't understand his question, he's taking a medication. And could I get you to turn your TV down some too, sir? You can just listen through the phone. All right, so he's taking a medication called Haldol. The generic is haloperidol, and it's one of our first-generation medications. We use it for conditions such as bipolar, schizophrenia, what have you. And so it kind of settles you down by bringing down the dopamine in your brain. Because when the dopamine is high, you can stay up 2-3 days straight. You will hear things that are not there. And you'll have, delusional type thinking. If you take for some people, it may cause an issue with certain side effects, which we call EPS, or extrapyramidal side effects. And so that can manifest in things, Richard, if you're listening, into something called torticollis. If you ever felt like you've seen people with their neck twisted and they're really stiff. And it could also manifest as something called tardive dyskinesia. So it's like a slow type of movement if you see somebody moving real slow, or if they're doing something repetitively. So that tremor in your hands, Richard, is most likely brought on by the haloperidol. How long have you been taking it? Richard? Okay, I think we lost Richard. So, and what happens is that sometimes it can bring your dopamine down too low, and probably almost put you in kind of like a Parkinson's type syndrome. And so we give medications to kind of offset those extrapyramidal side effects, or things like tardive dyskinesia, some of the side effects that he mentioned. You'll generally see a dose somewhere between 2.55, 10 milligrams. Some patients may require a higher dose if their bodies kick the drug out too fast. But yeah, again, one of our first generation antipsychotics. I don't see much of it anymore. You know, there are newer drugs out there that don't have the side effects that a Haldol does, but I would imagine that maybe these patients have been stabilized on it for a number of years. Very good question, though. Yeah, I appreciate that, man. You challenged me up in here. All right, looks like we've got Pharmacist on call. Let me help you. Hello?
Hello?
Yes, ma'am. How may we help you?
Hi, I have a question. I am just getting over COVID.
Okay.
And I wanted to know, is there something that I can take to restore my energy level? Because I get very tired throughout the day.
Okay. All right, how long has it been since you've gotten over COVID?
Actually, I got it like on the weekend of September the 24th.
Okay.
Yeah, and I guess it's been going on like about 2 weeks now, but I have started to feel better, but just not my normal self. I still feel very tired.
Okay. So you're probably starting out as a long hauler. Dr. Pruitt's potion has helped with people like you who are long haulers who still have symptoms after they've gotten over COVID, one of those being the energy depletion. I'd also recommend that you bump up your vitamin C, D, and iron as well. But this, let's make sure it's gone all the way, that your immune system has been boosted so that the virus has been completely shed.
Okay, so it's called Dr. Pruitt's potion?
Yes, ma'am, Dr. Pruitt's potion.
And I understood you to say that you have a store out in Antioch, because I live in Laverne.
Yes, ma'am. Yeah, we're right there at 2510 Murfreesboro Pike, next to Subway there, across from Truist Bank. So that's our fourth location. So I purchased that in May. If you, again, Pruitt's Pharmacy in Antioch in your phone, it's going to take you right to it.
Okay, and you do have that in your store now?
Yeah. He has Henry's the pharmacist over there. So yeah, we got plenty of potion over there.
Okay, thank you so much. I appreciate it.
Yes, ma'am. Thank you for your call. All righty, bye-bye. Let's see here. Okay. Pharmacist on call. Let me help you. Okay. All right. So I'm trying to think where we were here. We talked about prostate. Now, for you ladies out there, since we talked about prostate for men, let's talk about something that the lady Lisa called in, who won the free thing of Lydia Pinkham. So Lydia Pinkham is something that was developed by a lady named Lydia Estes Pinkham because she was kind of embarrassed to talk to her doctor about the fact that she was going through menopause, through the big change. And so she put together, I think, about 10 herbs or so to help her deal with the symptoms. And that product now has been sold probably close to 200 years now. So it's Lydia Pinkham in a little yellow box. I'm sure you've seen it up here before, but does a wonderful job with getting rid of the hot flashes, the mood swings, the night sweats. Lydia Pinkham, we sell quite a bit of it, so it doesn't stay long. So I recommend that for ladies who are premenopausal, perimenopausal, menopausal, and even for those ladies who are, of childbearing age, but you have difficult menses, difficult periods that are painful or what have you. So Lydia Pinkham, good for you ladies out there. Looks like we've got another Joanne here. Joanne, welcome to Pharmacist on Call. May I help you?
Yes, I was calling. You said that y'all deliver.
Yes, ma'am.
And I live in Columbia, Tennessee. I don't know that much about Nashville because I'm not from here.
Yes, ma'am.
And you said that y'all deliver. And I'm trying to figure out, okay, now if y'all deliver, how do I pay?
Okay, are you in Nashville or are you from Columbia and living in Nashville?
I'm living in Columbia.
Okay. Well, we don't deliver that far now. Yeah, we deliver within the Metro Nashville, Antioch / maybe Hendersonville if you're nice to me kind of area. We would have to ship. We'd have to ship to you, so you would call either of the pharmacies, and we would ship it out to you.
Okay, because I want that beet juice stuff you just did.
Yes, ma'am.
And the other that goes with it because I got liver problems.
Well, the beetroot juice helps people with liver problems because it has a compound in it called betaine. And so if you got cirrhosis or fatty liver, it helps to heal that.
Yeah.
Yes, ma'am. So yeah, beetroot juice is helpful for that too. Or if you want to take milk thistle for your liver, we sell that as well.
Okay, could I get both of them?
You can, yes, ma'am. Yeah, but
Okay.
so hang around to the end of the show. The producer's going to flash our number up there, and then you can give us a call tomorrow, and we can ship everything out to you. And you'll just pay over the phone, or I think we even take Cash App now. So we're trying to, get in with the technology.
Okay, just after the show here tonight.
Well, no, call in the morning because we've closed now. There's nobody there. But call in the morning after 9 a.m.
All right, then. Thank you very much.
Yes, ma'am. All right. Thank you for your call.
Uh-huh.
All righty.
Bye.
All right. Bye-bye. Okay. Pharmacist on call. Let me help you.
Yes. I was just wondering, I've had chronic pain for 40 years. The doctor messed up my arm, and I had to have it took off.
Uh-huh.
And I just have a lot of pain, and I tried everything.
All right. So you've had an arm amputated?
Right, part of it, just my hand, basically.
Oh, okay.
But I was in a car wreck, and they cut it real bad, and the doctor, he was an Army doctor, and he tied nerves, ligaments, and everything else. I went to 3 specialists in Nashville, and they said a 5-year-old could have done better.
Okay. So are you having the phantom pain? Like your hand is hurting? It's not that? Okay. What I recommend then is this hemp oil. And what this does, this stops the transmission of that signal. But since you've got that exposure potentially there, I probably recommend the hemp lotion too. This is something that you can apply directly to the area to help with the pain. This one you can take by mouth to help with your body systemically for pain. You're one of those few cases I'd recommend both for you.
Yeah, I'm taking those. And it still ain't enough.
You're taking these?
Yeah.
Okay. How many milligrams? I mean, how many dropperfuls?
2,000 milligrams of liquid and gummies.
Okay, and the gummies?
And then the cream is I got it at the hemp store.
Okay.
And it's a medical cream supposed to be for pain. Which it helps. It helps.
Okay.
But,
Okay.
you
Have you looked at going into pain management?
know, I've been to pain. This has been a 40-year thing.
Okay. Okay.
And I've been to pain management. I've got hooked on OxyContin. I nearly died.
Okay.
And it happened to me when I was 29 years old. I was in my prime. And it's just about controlled my life. It cost me my marriage. It's cost me my affection for my kids. So somebody hurting all the time is not good to get along with.
I understand that. I understand. I would look at maybe changing the brand of hemp that you're using and see if you're getting a result from another company. Since you got it from a hemp store, you've tried them all?
Yeah, well, I spent a fortune trying to get rid of this.
Okay.
And but now today I heard Biden, they legalized it today, didn't they?
I know. I think he just, from my understanding, he decriminalized all of the people who had federal cases. I think they're working on legalizing it, but I don't think he's fully legalized it. So I think he's taking the first step in trying to decriminalize it.
Yeah, well, he said today that, he didn't want to see nobody else put in prison or jail over this marijuana.
Okay. Well, perhaps he have. I'll have to see what the latest news blurb is. Yeah, if you've already tried the hemp, then...
The gummies help better than anything.
Okay. Now, have you tried the Delta 8? Or just a...
Yeah.
Okay.
I've tried Delta 8, Delta 9, Delta 10.
Okay, well, yeah, you've run the full gamut then. Now, is it where you're getting relief and then it wears off after a certain amount of time, and you maybe just need to do it more often?
Yeah.
I'd probably just do it more often then.
Okay, it's awfully expensive, but I mean, I don't know when they legalize it, the prices will go down a little bit or go up. But just like that CBD oil, I had to pay nearly $100 just for a little bitty bottle of it.
Okay, well, no, ours is cheaper than that. I think our cheapest bottle is like $20 for a bottle about the size of my pinky.
Yeah, this is 1 gram or 1 ounce, maybe.
1 ounce. I think our cheapest 1 ounce is $40. So yeah, but it looks like you've already tried my solution. It's not working for you. Maybe ask your doctor about something called gabapentin, and he may have to take you up to 800 milligrams 3 times a day.
I took that.
You did? No luck on it either?
No, didn't look on there.
You have, yeah.
That stuff, it could kill horse.
Okay.
I'm on 22 medicines a day.
Okay.
And I'm 75 years old, so, you know, I just don't want to spend what little life I got left is just sitting there hurting.
Understood. Okay, well, it looks like you've tried everything that I would recommend. I'm sorry that, we're not able to help you a little more.
Yeah. Well, I appreciate it. I've tried everything I possibly know. I've had nerve blocks. I've had everything done. None of it's helped.
Okay. All right. Well, hang in there, sir. I see the effects.
Thanks for your help.
Yes, all right. Thank you.
Bye.
All righty. Bye-bye. Okay. See what we got. Very tough call. Pharmacist on call. Let me help you. Hello?
Hello?
Yes, ma'am. How can I help you?
Oh, yes. I have a question.
Yes, ma'am.
I want to know, do you have anything for overactive bladder?
Yes, ma'am. I was just talking about it maybe about 5 minutes or so ago. It's called pumpkin seed oil. And so that helps that overactive bladder, stops all that spasming right there. Yeah, but it's pumpkin seed oil. It comes in capsules or it comes in a liquid oil.
Okay. Where do I get that at?
From Pruitt's Discount Pharmacy.
Oh, okay.
Yes, ma'am.
All right.
Yeah, so give us a call tomorrow after 9 a.m. and we should be able to help you out. If you're in the area, come see us. If you live outside of Nashville, we can ship to you.
Yeah, I live right across the bridge. I live in Germantown over here.
Oh, yeah. You can come see us then.
Okay. All right. Thank you.
Yes, ma'am. All right, thank you. All righty, bye-bye. All right, everyone. We're up on another break. Stay right there. We will be right back.